Assalamu alaikum. I'm Dr. Ahmed Lotfi. I'm a senior consultant obstetrician and gynecologist. I have been practicing in UK, New Zealand, and in the Middle East. This is the second video about hypertension in pregnancy. We start with management principles. Number one, early diagnosis and management should be in critical care centers. Close monitoring and prompt intervention. Treatment as preeclampsia if in doubt. These are the three principles, the three initial principles. Mild preeclampsia management. If the patient is less than 37 weeks, admit for 24 hours, monitor. Weekly outpatient follow-up. If there is no deterioration, self-monitoring is recommended, counsel about the dangers, and admit if there is any deterioration and manage accordingly. Severe preeclampsia and eclampsia syndrome, delivery is required. Delivery is the ultimate treatment of the severe preeclampsia and eclampsia syndrome. And it is required if eclampsia, severe symptoms, headache, blurred vision, epigastric pain, hyperreflexes with clonus, generalized edema. And if the blood pressure is uncontrolled or there is organ dysfunction, liver and kidneys, delivery is required. Also, if there is a fetal distress, this should be delivered immediately. Steroids could be considered if the gestational age less than 34 weeks, but in most cases there will be no time to delay the delivery for 24 hours. And also steroids could deteriorate the hypertension syndrome. Management of severe preeclampsia and eclampsia. Key principles: nursing, medical, and obstetric treatment. Nursing should be in critical care unit. Key principles in the management. We should first prevent or control fits, control blood pressure, expected delivery if required, as mentioned before, monitor the patient for vital organ failure, and prevent infections. Drugs for seizure and blood pressure controls. To prevent and control fits, magnesium sulfate, first choice, and diazepam is second choice. Control blood pressure, first choice hydralazine and labetalol, and prevent infection, broad-spectrum antibiotics. Nursing and medical treatment. Nursing should be in intensive care settings if the patient is in eclampsia. And left lateral position, clear airways, suction if needed, and welling catheter, IV access, and monitor vitals. Medical management of fits, magnesium sulfate or diazepam, antihypertensives, hydralazine, labetalol, or nifedipine. IV fluids, oxygen, and monitor vital signs and investigations to monitor organs functions. Obstetric treatment. If the patient is in labor, no fetal distress, vaginal delivery could be allowed for a short period. Fetal distress, cesarean section or assisted delivery. If not in labor, assess gestational age, maternal and fetal conditions. Then the route should be decided, either cesarean section or induction of labor if the patient is favorable for short trial of labor. This is the end of the second video about hypertension in pregnancy. Thank you.